Hi everyone, I'm JD. Thank you for watching, and this is my first pre-op video for VSG. Today is Saturday, December 30th. Surgery is on Monday, January 30th, 2018. 30 days to get ready to do this all over again. So why all over again? Before we get into that, I would like to take this time to give you a little bit of information about myself. I am 5'10". I weigh today 280 pounds, and at my highest I was 356 pounds. In 2010, I underwent laparoscopic adjustable gastric banding surgery at Magee Women's Hospital of UPMC. The entire hospital stay, from the pre-approval process to the 6-month physician-supervised diet, everything went extremely well, and I lost a total of 155 pounds. So, surgical weight, 346. Lowest weight went down to 191. So once again, 155 pounds lost with lap band procedure. Now keep in mind, that is not typical for most lap band patients, but I worked hard and I achieved my goals. After surgery, I hovered around 225 pounds. At that weight, I looked good, I felt good, and I thought, hey, life is cool. So I did a lot of maintenance, watched what I ate, went to the gym, and I was cool. So let's fast forward to today, 7.5 years later. Over the years, like I said, I've maintained a pretty healthy living with eating and drinking and doing everything else like that. I try to stay away from foods that I can't tolerate with my lap band. I try to stay away from soda because that's just like not a good thing. And I drink a lot of water. So I do try to log most of my meals through MyFitnessPal, whether that's snack, breakfast, lunch, dinner. I do that about 3 or 4 days a week. Sometimes I'm not cool with it, but I really try. I also am very active at my gym. I go to a Planet Fitness here in Pittsburgh. I take classes regularly. I really enjoy the circuit and the PF360. Totally work out. I also track my fitness through my Apple Watch here, which is really cool as well. So my question is, why the weight gain? A few months ago, I started having this really horrible sensation. I kind of thought it was chest pain. So I had emailed my doctor to say, hey, I'm not feeling good. What's going on? So he said to come in for an appointment. So went in for my appointment, and he sent me for some lab work and some diagnostic testing. So with the diagnostic testing, he ordered a upper GI series and a gastric emptying test. Now this is the first time I had this test. The upper GI, I usually get done yearly as just kind of like a maintenance for the lap band. So that was a quick, easy 20-minute procedure in radiology. And then the other part was done in nuclear medicine for the emptying test. So that involved me eating eggs, nasty, with a radioactive substance in them. And they did an image before I ate, and then they took an image 30 minutes, 1 hour, and 1 hour. So I was there like half the day. About a week later, my doctor called and said, I need to come back in. He has some news. Now this is news he can't tell me over the phone. So something must be up. Went in for my appointment, and my doctor said that my lap band had failed and it had slipped out of position, causing it to malfunction. So that kind of is the answer for the horrible acid reflux, the profusely sweating like at random periods of the day after almost any meal, me being able to tolerate more food, however, more food getting stuck in my band. So overall, it's just like a bad thing. So I thought, he can go in, fix the slip, and, I can go on my way and get back on track. So that's not exactly what happens. I had two choices exactly to make when I left that office. The first was to have the lap band completely removed. That would be one surgical procedure, go in, cut the band out, remove the port through about a 3 to 4 inch incision. It's to the right of my belly button, and totally be done. Or we can do a conversion surgery. The conversion surgery is a removal of the lap band with a conversion to the vertical sleeve gastrectomy procedure. Now, for some of you that don't know about this procedure, let's just talk about it for a second. This procedure has been done as a first step in morbidly obese patients who are going to have gastric bypass, eventually down the line. So it's relatively a safe procedure with low risk of complication, bleeding. Other than that, it's a pretty simple procedure. It requires a 2-night hospital stay, and that's just so that there's no leaks within the new stomach lining and to make sure that you obviously are okay health-wise. So at that point, I have a lot of research to do. So like I said, I read about the surgical procedure, the risks involved, any complications, and obviously I turned to YouTube because there are a ton of videos, a ton of people that had lap band, gastric sleeve, bypass, any kind of bariatric surgery performed. It was just nice to kind of see what they went through, the problems that they had, whether it's good or bad, and their outcomes. So that's what I'm bringing you here today, is my first pre-op video. And to bring this video to a close, I would like to say to the bariatric community, thank you for posting your videos, comments, questions, concerns. Keep doing that because it helps me a lot and it helps other patients who are thinking about these procedures. Also, if you have any questions or concerns, I'd like to hear from you because this is another journey that I'm taking and I want you guys to experience what I'm experiencing as well. So post questions, comments, concerns. You can also follow me on Instagram or subscribe to Reporting Live 34 here, which is my YouTube channel. So let's wrap this up. I am going to post a video probably a few days prior to surgery because I will start a 10-day liquid diet and then probably bring a really fast video to you day of surgery and then start my pre-op videos, post-op videos. So once again, I am JD. Reporting Live 34 is my channel here. Thank you for tuning in. Thank you for watching, and I'll see you in January. Take care.